Hey, Scott Jordan and Mark Warner here for Jancast number 178 for Thursday, October 17th, 2024. And Mark, the leaves are coming down. It's winter's coming, but let's get to the news.
Hey, well, I'm really thrilled that we have a couple celebrity guests
Yeah,
today. So, Dr. Gavin Macgregor-Skinner is joining us, along with Dr. Omrana Pasha-Razzak, who are both involved with some projects that are fascinating to me.
yeah.
And give a wave to everybody, man. Give a wave. Yeah. So, this is like fantastic. So, these are friends of mine and Scott's. So, we're just
Yep.
happy to have them on the Jancast with everybody. Some stuff in the news, Scott. I know that's
Yeah.
been kind of like the big thing. Like, wow, what's happening?
Yeah, stuff that ties in with what we're going to be talking about, I think, a little bit. Amazing. The coincidence is just mind-boggling.
Yeah, it's called synchronicity or something like that. I don't know. But, it's all about things like making sure environments are healthy and safe, right?
Yeah.
So, along that theme, there's a whole lot of stuff that's happened in the last couple of weeks. And, one of them has been a broadcast, a webcast that was just put on by ISSA, which had John Atkins, and John Atkins is executive vice president of the ISSA, along with Stephen Ashkin, who's kind of an outspoken guru on all things related to green and sustainability. He's written a lot on that, and they did a great job. They did a fantastic job. And my takeaway from that, Gavin, was the LEAD conference is here in Philadelphia in November. I was like, wait, what? How do I not know that? So anyway, I might have to pop over there and say hi to Steve Ashkin when they're here in
Yeah.
Philly. But the LEAD program is Leadership from Energy and Environmental Design. So the whole idea behind that was to educate architects and builders on making buildings safe and healthy, right? So all of that kind of segues into things that the EPA is doing about kind of enhancing their safer ingredient list. And
Yep.
and Scott, it reminds me the most of the interviews we did with Dinesh Wadhwani and Dr.
Hmm.
Charles Gerba.
Yeah, it's all tying together.
Yeah,
Yeah.
those conversations were fascinating to me. Like, I don't know if you know about this, Omrana, but there's such a thing as the villainous toilet flush plume.
And
Yes, so
the carpet plume too.
the carpet stomp plume, the sink splash faucet plume.
Just
So anyway,
hold your breath when
and where you place your toothbrush in comparison to its geographic location to your commode. But with all that said, that was like Charles Gerba, who did a lot of research on that stuff. And Dinesh Wadhwani has been a specialist in indoor air quality with monitoring equipment for monitoring the health of indoor air and providing solutions for that. So the big message of all them was that surface cleanliness can impact indoor air quality and what we breathe. And we know that from VOCs of products to allergens to respiratory distressors, but vice versa. If the air is really nasty, things will precipitate out of the air and affect the cleanliness of surfaces. So it turns out that these things interact so radically that we can't do one and ignore the other. In fact, Scott and I have often joked that if we'd have known all this back when COVID first happened, we'd probably
Yeah.
done things a little different,
Yep.
But with all that said, we've been studying things like cradle to grave and what we're doing with the environment and all that. And Gavin, we were so thrilled to see your quote pop up on a press release. I talked about it actually to the entire staff here at Bullen regarding P2, and I was hoping that maybe you could kind of give us a kind of a segue into the topic with what P2 was really all about.
Well, think about it, Mark, and Scott, you guys have been around for a while. How often does our industry use pollution prevention or that P2 terminology? And if we are using it, fantastic. If we're not, then we've got to ask ourselves across industry, why not? And so we're going to talk today about a funding opportunity that we won from the US Environmental Protection Agency. It's a P2 grant or pollution prevention grant. And pollution prevention is also known as source reduction. So that's any practice that reduces, eliminates, or prevents pollution at its source. And our program is to look at the EPA Safer Choice labeled products. Now, if I said to everyone in the industry, right, how many products are there? Do you know? Well, there's 2,133 products that
Hmm.
ISSA member manufacturers and other organizations have been working on for nearly over 15 years. So there's 2,133. But at the beginning of the year, there was only 1,900. So the EPA has actually got on target to actually add 400 new cleaning products to that list. So at the
Wow.
moment, we're at 2,133. Now, the grant that we were awarded by the EPA, and we're going to talk more about that, was an opportunity to look at how decisions are made and are they informed decisions. And that's what we're doing right now. Are the decisions made? And we're focusing on a 2-year project in Pennsylvania, New York. The way that buildings are cleaned, are they informed decisions?
I love the fact that the number doubled from 1,000-ish to around 2,000 products being made available through Safer Choice. And I think you made the comment to me, Gavin, that an awful lot of them came from ISSA membership companies, right?
Yep.
Yeah, no, and this is really important. Again, and we're working with ISSA as a trade association. We've formed a partnership with Penn State uh, University. Dr. Rebecca Bascom is the principal investigator there. And then we've also formed a partnership with the City University of New York with Omrana, who's on the call today. And this is really key because we're actually conducting a lot of information gathering, data gathering at the moment. When you look at a trade association that partners with two, renowned, very
Yeah.
well published, has the capabilities to do massive research, collect huge amounts of data. And we're now focusing on Pennsylvania, New York. This is this 2-year project to find out how so many facilities, and we'll go through that list in a second, how many facilities actually have made a decision on how they clean. And then from that information, when we take all that data, all that evidence, we then generate it into knowledge, into information that's available right down at the facility level on how to make more informed decisions when it comes to cleaning a particular building.
So I think the amount of money you told me that was up for grabs was around $12 million, right? And out of that, what, about a fifth of it or whatever was given to the project that Penn State and CUNY, CUNY, is involved with? CUNY, yeah. So that's fascinating too. Like both near and dear to me because it's close by. And I hate to say this, Omrana, but alma mater is Penn State, so got that blue and white in my.
I was at Penn State just a year and a half ago, so my heart is in both places.
There you go.
It's a good point, Mark. The U.S. Environmental Protection Agency, the EPA, awarded 24 grant projects, research projects. We were one of 24. But what's significant about our work, ISSA, Penn State, City University of New York, we were awarded the most money. So we're the number one project out of that list of 24. And I think a lot of the industry don't know how much research is going on at any one time, any day of the week across the cleaning industry. It's huge. There's lots of research going on. And so there's 24 funded projects by the federal government. We'll be working in Pennsylvania, New York. We were awarded $1.2 million. So when you bring in a trade association with all its members, you bring in really smart, clever, experienced professors from universities. Sit back and think about what we can do with that money, how much data, evidence, information we're going to gather over the 2 years, and then what we're going to do with it afterwards. That's all been laid out. So it's so important because what we're finding right now with our initial surveys, the budgets for cleaning a government building, a convention center, a hotel, schools, universities, airports, supermarkets, nursing homes, beauty salons is significant. It's huge. These are big budgets. How did they make the decision to buy what they buy with those big budgets? That's what we're learning right now.
Cool.
So what if we took that down to kind of the common man and how a project like this has an impact on men and women and society in general? Like, what is it that we're trying to accomplish in their behalf? what result might they see from that? And I know, Omrana, you and I talked about that a little bit
Yeah.
earlier, about there's lots of ramifications. In fact, you had brought up a point I didn't know about, having to do with surface cleanliness and indoor air quality and how they interact, and how there's a sensitive part of our population that I really didn't know that point. Could you touch on that?
Yeah, so thank you so much for having me. So my work is largely in women's health, and the reason that I was so interested in joining Gavin and Dr. Bascom on this project was that um, it, I had a sense that most people involved front line in the cleaning industry were women, but Gavin then informed me that 80% of frontline cleaners are women.
Wow.
And we were talking about indoor air quality, just like indoor air quality, exposure to chemicals, especially toxic chemicals, for women is a sort of twofold problem. One is the problem to women's health themselves, but also when women are pregnant, anything that mom is exposed to, whether it is poor quality indoor air, or it is toxic chemicals, because mom is part of the cleaning industry, will affect the fetus and the growth of the baby. So those are really important points, and I think that's something we're going to try and explore in our research.
I love that, and I think that's fantastic. Going back to something Gavin had said earlier when he talked about P2, a lot of it seemed to weave around source reduction. And so, that part of it is pretty interesting, not just to me and Scott, but to a lot of our Jancast listeners, because many of us involved with either the supply chain of the Jansan industry or involved with providing services. So I wonder, is that purely about the chemistry itself, or is the packaging part of that conversation too? Is it all about a big picture of source reduction?
Yeah, so that's a good question, Mark. The federal government has invested probably over a 15-year period on a particular label, the Making Safer Choice label, the EPA Making Safer Choice label. But let's look at this as let's look at this at another EPA program. Are you familiar with Energy Star?
Sure.
Mm-hmm. Yep.
Right. That is
there's one of those, I think, decals on my air conditioner.
right. So that's a federal government, US Environmental Protection Agency, an EPA program, Energy Star. It's probably one of their most successful programs because you just recognize there's a label. I think it was on your air conditioning.
Or my refrigerator, one of those
refrigerator.
Two.
And it really helps helps make informed decisions. So that's an EPA program that we are trying to follow along sort of the pathway that Energy Star took. And how do you bring it over into how do buildings get cleaned, where the decisions are made with a Safer Choice label, which has 2,133 products. We know we can clean any building with any product, with any active ingredients, if we follow the label, the instructions, the manufacturer's instructions, and we do it in a way that's safe. We can do that. But wouldn't it be great if people could make decisions based on ingredients of products that are safer for the building, for people, for animals, and the environment, and they knew about it? And so part of our project is to find out, go back to these key decision makers. That the biggest challenge we're having at the moment, Mark, is who makes the decision on how that school gets cleaned and pays that budget? From a mayor's perspective, if the mayor's office pays for the airport or the convention center, who in that whole value chain is making the decision on what you buy? Yes, the budget gets approved, but how did you make the decision on what tools, equipment, processes, as well as cleaning products and their ingredients? Who made those decisions? And this is what Omrana and Becky and I are learning right now at the moment. Where is that decision maker? Which corner of the meeting room does that person sit? And how do we educate and make them aware based on the science of cleaning and ensure that the decisions they make are informed? And this has been fascinating. We've gone to schools. Omrana and I went to New York City. We went to a commercial building that goes vertical, 467 bathrooms, toilets in that building that get cleaned every day. And we sat there and we went, wow, 467. I've never walked around New York City and looked at the buildings going and think how many rooms, how many toilets are there in that building? There's 467. And Omrana, I said, I wonder who makes the decision on how they get cleaned, because they're cleaned every day, and who made the decision on how they clean them and what they used, what cleaning products they used. And that's where we are right now.
Yeah, it's probably right now it's probably more marketing than anything else. So it's great that you're bringing closure to that. And then just for everybody's info, because Bullen has a bunch of safer choice products the market brought up. Part of the approval process does involve packaging and source reduction and stuff. So it's not just using the clean ingredients list, it's the whole thing. It's the chemical, and we have to show the recycled content and bottles and all that. So it's great that you're pulling together, because in the past, I know there's been certain regulations that are put through legislations in certain states that say, okay, all state funding, or all state purchasing has to be X. But if it's done state by state, that's going to be rather difficult to really get the consensus. So part of what you're working on, I guess, is to be able to get the thing that would be able to be handled nationwide versus state by state, right?
Yes, that's a great point, Scott. So the federal government changed, you're probably aware of this, they changed the procurement requirements for federal government buildings this year in 2024. And that requirement is all federal government buildings need to be cleaned with a safer choice labeled product. Yeah. So everyone wants to go, who cleans the Pentagon? We know that. We're working on that. Who cleans all the different government buildings, both in Washington, D.C. and others? And what we're seeing also at the state level, governors now are going, hang on, if the federal government's made that decision that all federal government buildings get cleaned with products that contain safer ingredients for people, the buildings, as well as the environment, wouldn't we be doing something like this for the state government buildings? Yeah. And that hasn't happened yet. And then we're now seeing mayors talking about, wouldn't we do this for the local government buildings? So we're seeing this sort of, I call it like a tsunami, a wave of decision making that's changing based on that federal government change this year. And I'm pretty sure we're going to see coming into 2025 at the state government level and the local government level, where governors and mayors are going to say, right, if that's what the federal government standard is, we're going to do the same thing.
Yep. Excellent.
We see a lot of movement even at the local level, which is interesting because people don't necessarily associate that as being as impactful as things at a state level or federal level. But people don't necessarily realize that an awful lot of international airports are literally local government driven, not necessarily state or federal. So they are part of a city of Philadelphia, for example, is part owner of the Philadelphia International Airport. Same thing about Baltimore, Washington International. So those are areas where a lot of us are actually seeing a government building, not realizing we're walking through it as we're traveling. So so that all actually plays into this, and local as well as state and federal can all have an impact in our everyday lives.
Yeah.
Right.
Yeah.
And so another state building or government building to think about are public schools. And Gavin mentioned earlier, I spoke to the physician who is responsible for all pediatric care on the Upper West Side of Manhattan. And I mentioned our project to her, and she spoke with great enthusiasm about the need for this project because, of course, whatever we clean schools with also impacts the health of the children who attend those schools. Mm-hmm. So she's an elementary school. She's the pediatrician who's responsible for elementary schools in New York. And she was very interested to hear our findings and help us think through how that would affect the health of the children who attended those schools.
Yeah. You know, what I like the most about all this is that if you go back long enough, a lot of the decisions made regarding the health and safety of chemicals were a direct result of injury or death. So things happened that were really negative, and then decisions were made to eliminate them. And that was kind of the pattern of things. You think about the changeover in Freon, which was affecting the environment.
Yeah.
And the changeover in CFCs being removed from aerosol cans and all that. That goes back 25 years. But, a lot of that was driven because of maybe injury or damage that was occurred in one way or another. And so the fact that there's folks like you that are so well educated on this topic, driving the research on it, it just warms my heart. I mean,
Yeah.
it means that we don't have to wait for something injurious to happen when there's folks that are actually taking that frontline charge to take a look at all products and make sure that they're not injurious to people or the environment.
So what is the actual timeline for the project? You guys have a like 2-year window, 3-year window? Is there something specific to how long you have?
So this project is a 2-year project, and we are about 1/3 of the way in, Gavin.
Yep. Yes.
Good. Okay.
And I just wanted, this is important. Again, I'm going to emphasize the fact that I'm not easily excited, Scott, but the fact that a trade association now in partnership has been awarded a federal government grant with 2 universities.
Yeah.
That ability to work with universities and gather lots of information, lots of data, and then interpret and analyze that data. And it just doesn't happen with us. We are forming collaborations now with ISSA member companies. We're forming collaborations with other associations. There's associations out there that represent supermarkets, schools. There's a mayor's association. There's all these different associations. And Omrana and I go into the same meeting every time going, well, how do you clean the buildings that you're responsible for? And everyone looks at us going, why did you ask that question? Because it's really important for the health of the building, the health of the people, and the health of the environment. And just starting there as our starting point is forming these collaborations, which allows us to do that deep dive down to the local level and then find out how those decisions are made. And then from that, when we get that information there, we go back up and go, right, let's look at the value chain, the supply chain, the procurement mechanisms that are in place. How do we strengthen those? How do we improve the procurement at a school like Omrana went to? And went, how did you make your decision? Your budget's significant, but how did you make the decision? And what we're often getting is, well, we've been doing that for 15 years. And our goal through collaborations with facilities, facility managers, as well as associations that influence cleaning budgets is help them make better decisions, informed decisions based on the data that we have, but also the data that others have already. There's lots of information out there that are, I call them these islands of excellence that we never brought together. And so when people say, well, Gavin, what does all this look like after 2 years? It's a shipping container. It's the size of a shipping container with education, training, awareness, information that people can understand and make better decisions.
Yeah.
I love where you're going with this. My kind of my final thought on the whole thing is like, I think there's going to be a lot of people listening to this Jancast. They're going to get as excited and enthusiastic as you both are.
Yep.
And so the big question, I kind of look at it saying, hey, Omrana, how can I help, man? How can I help? And I think there'll be a lot of listeners that'll be thinking like, what can we do to help this? Because this is really cool. What kind of help do you look for in your group, your research group?
So I will say that, Gavin always talks with great enthusiasm about partnering with universities, but it's been a great partnership to work with ISSA as well for us as universities, because one of the things that we don't have is as ready access to the people who are actually affected or actually the decision makers, which Gavin has excellent list of and very long list and very cooperative list of partners like you guys. And that gives us the access to talk to you. So any of your listeners who are interested in talking with us and sharing their experience and their thoughts, that to me at least would be the most important thing that they could do, is to reach out and say that they would be willing to participate and share their knowledge.
Yeah.
Because that's what universities do. We take knowledge from everyone and then put it together and say, this is what is known about this.
We'll share some notes, links to get in touch with you folks below the Jancast when we publish it out. So great. Well, this has been an excellent discussion. I think it ties in beautifully with all the stuff we've been talking about over the last 6 months or so, and the evolution of the way we're analyzing all the stuff. But I think the bottom line is, as Gavin said, healthy buildings, healthy people. That's the vision, right?
Yeah, it is. It is, Scott. If we could just sort of finish up with what's happening, if you're going to collaborate with Penn State University, City University of New York, and ISSA as a trade association in 2025, what does that look like? What does that collaboration look like? And the events and I'm just going to quickly go through what Omrana and the Penn State team with Dr. Rebecca Bascom and myself have planned. We're looking at workshops and seminars,
Good.
on-site product demonstrations, information sessions, training programs. We're looking at developing a train the trainer program to help those key decision makers make informed decisions. We're going to look at how to work at the local level in decision making. Who are the influencers? You know, when you go to a supermarket, do you stop for a minute and go, I wonder how they clean this supermarket? And are they cleaning it in a way that keeps all the food here healthy and safe? When you walk into an airport, do you think for a moment, how did they clean this airport? We are seeing this whole movement through schools, factories. Omrana and I have had some contact with some factories that are amazing. And so we have money in our budget to do storytelling. And what I mean by that, if you look at what the ISSA media team has done over the years in the way that we create these storytelling videos about experiences. So what we're doing, we're reaching out to a lot of organizations, a lot of facilities across the whole spectrum of facilities and getting their stories. How did you clean today? Based on our project, how are you going to clean tomorrow? And have that as and we call that that sort of those persuasive narratives. How do you tell the story of how you maybe changed your procurement supply chain, how you changed your processes, how you trained your workers, how you trained the decision makers, all becomes a story which we hope will influence thousands of other facilities.
Excellent. Great. Well, thank you very much for joining us. And I think this is a great Jancast. It's going to be interesting to look back on it a couple of years from now and see what cause and effect and all that, right? And everybody, if both of you are going to be at the ISSA show, stop by our booth. I won't blatantly plug my booth number at this point, but we're going to be there.
Don't say 38.
Along with our
53.
F1 car we're going to have in the booth too, right? So you got to stop by to see it, right? Well, thank you very much for tuning in, those of you watching, and thank you, Gavin and Omrana. I appreciate it very much, and we will see you at the next Jancast then. See y'all.